This is a draft for the net learning module. I want you guys to review to see if this will be an appropriate outlet for using a screencast in conjunction with a PowerPoint presentation to try to help aid our learners to really better understand this material. So our learning objectives for the screencast will be to allow our staff to understand the signs and symptoms of measles, to know the steps involved in confirming the diagnosis, to be able to activate the hospital plan for a potential measles exposure, to understand the management principles of both an acute measles infection as well as those patients that come in with a high risk exposure. And that really focuses on what we talk about, the post-exposure prophylaxis. To understand really the whole context of this, we're talking about not only protecting our patients, but also our staff. And now this is really a public health issue. And to be able to look into the community in the event of a potential measles exposure and what we can do to kind of really limit the exposure and contain it. And finally, we created a White Plains Hospital measles checklist to really help you navigate this whole process. So what this means for you both in the hospital setting, the emergency department setting, as well as in our outpatient sites. So the first thing we're going to go over is really the symptomatology of an acute measles infection. And one thing to know about measles is it's really heavily transmissible. We're talking about a 90% infection rate in susceptible populations. And when we talk about susceptible populations, we're talking about those of our patients that are immunocompromised or don't have their full set of vaccinations. Now, what measles classically presents with is a high fever, often greater than 104. And then it comes with the typical 3 C's that we talk about, which is the cough, the coryza, and the conjunctivitis. Now, these are the prodromal symptoms. And what ends up happening is that the rash tends to develop about 3 to 5 days after the symptoms develop. But it's often during these symptoms prior to the rash where the patient is most infectious. Now, when we're talking about the incubation period, it ranges from 7 days to 21 days. Humans are the only known natural host. Now, measles can be, as we talked about, contagious 4 days prior to the onset of the rash, and that's really when it's most contagious. And then the rash develops, and then oftentimes it's self-limited after that. And even though it is a self-limited disease, it does have some well-described complications. Now, about 1 in 4 of patients who get measles will be hospitalized. About 1 in 10 children will develop a bacterial otitis media. 1 in 20 children develop bacterial pneumonia. 1 in every 1,000 develops acute encephalitis. And usually about 1 in every 1,000 child dies from either respiratory or neurologic complications from measles. Now, this is a great video from the CDC. If we could possibly embed this video, it's about a 3-minute video, into this net learning module, it would be great. The reason being it actually has videos of patients with active measles, so people can take a look at the complex spots and the type of rash and how it coalesces, and it's just better to walk them through it than actually look at images itself. Now, when a patient comes in or calls into the clinic or comes to the emergency department in triage and they're saying they have a fever and a rash, a couple of questions to go over. One, do you or your child have a fever and a rash? Is that yes? Then do you have a cough, a runny nose, red eyes? Have you been exposed to someone who may have had measles in the last 3 weeks? And I would even go a step further and ask them about their immune status in regards to the measles vaccination. If anybody answers yes to really any of these questions, then they should be masked, put in negative isolation room, and the provider should be immediately communicated to so that they could come and evaluate the patient. Now, when we're talking about confirming the diagnosis for measles, you'll need to call the Westchester County Department of Health at this number. We'll go over the checklist at the end of this program, which will help guide you, and we have all the numbers, all of the forms available on the internet to really make this as simple and easy for you as possible. What you'll do is through the Department of Health, they'll guide you in regards to which test to order, but to let you know offhand, it'll be a serum test and a nasopharyngeal swab. There's an infectious disease requisition form that we have on the internet that you'll print out, as well as a suspected measles information form. You'll fill both of these papers out, and along with the test, there'll be some hand walk down to microbiology after they've been labeled with the appropriate forms. When you order these on Meditech, it'll be under micro miscellaneous test, and you will indicate suspected measles case under the test. Now, let's say you have a patient, as we talked about with the screening, that you're concerned might have measles. You will be masking that patient and walking them to a negative pressure room. You should clear those hallways to prevent any potential exposure to any other patients. Now, ideally, if they come to the emergency department, we will walk them through the ambulance bay where there's a decon area and walk them straight into room 2 where there's a negative pressure room. So we're going to have signs that are posted outside the emergency department, and we have asked our EMS providers that if there's a potential exposure, they call us about it in advance so that we could actually have a staff member walk them to the ambulance bay and through the decon area into room 2 to try to avoid these patients coming in through our waiting room. Now, once they're isolated, please obtain the measles checklist from the intranet. Contact the Westchester County Department of Health. This is listed on the checklist. You will need to, this is a community health issue at this point. Assess the home situation for self-quarantine, the immunization status of the patient, as well as those in the house, the immunocompromised status, the ages, is there any newborns under 6 months? Contact the White Plains Hospital measles support representative at the following number, and notify patients who may have had a potential exposure in the hospital in the waiting room and fill out their names in the exposure list template, which is also on the intranet. So when we're talking about identifying and managing these patients, let's start with the column over here. So you identify this patient as a symptomatic patient that you're concerned may have measles. They come in with a high fever, they've got the 3 C's, they've got the Koplik spots. Now these Koplik spots are pathognomonic for measles. They basically present themselves 1 to 2 days prior to the rash, and they last about 3 to 5 days. They're basically these bluish gray enanthema, and they have a red base, and they're typically seen on the buccal mucosa opposite of the second molars. So if you see those, they're not often present. The more common things are the high fever, the cough, coryza, the conjunctivitis, and then the rash. But if you see them, they're pathognomonic for this disease process. So you're concerned about that. So you put them in an airborne isolation room. The healthcare providers are aware. Everybody that walks in wearing an N95 mask and personal protective equipment. And you call the Department of Health. You obtain the measles antibody serum samples, both through the nasopharyngeal swabs as well as the serum testing. You've notified the hospital representative and the local health department. So that's kind of the workflow. Now, if a patient comes in and they're not symptomatic, but they tell you that they had a high risk exposure, that also is concerning. And so, you'll have to assess their evidence if they've had any evidence of immunity, and evaluate them for post-exposure prophylaxis. And to make this simple for you, we've also posted the post-exposure prophylaxis form on the intranet. And what this goes over is an asymptomatic patient who has a high risk exposure and what the indications are for treatment, whether immunoglobulin or the MMR vaccination. And so these are for patients who are not pregnant or immunocompromised. And there's a separate document that's post-exposure prophylaxis for those who are pregnant or immunocompromised. And this will be done in conjunction with the White Plains Hospital infection control representative as well as the Department of Health to assist you in this type of program. Now remember, this is a public health issue. We want to make sure that we contain this infection. So it's important that you wear an N95 mask and personal protective equipment and have this patient in a negative pressure room. When transporting this patient, they must be masked and the hallway should be clear. If there's any potential patients that were exposed, they must have the exposure list template filled out, which will be on the intranet. You'll have to evaluate given the public health issue, and this will be done in conjunction with the Department of Health, indication for home quarantine, and assessing all those that live in the household. And EVS will have been trained in regards to cleaning these rooms, but that room cannot be utilized for 2 hours after the patient leaves and has been cleaned. And if there's significant exposure either in the waiting rooms or in a triage room or in your outpatient office or in the urgent care center, then that area also needs to be closed down and cleaned in the appropriate way for at least 2 hours. Now, this is the checklist that we set up, and this is available on the intranet. And the first part of the checklist really helps guide you through the symptoms in regards to if this can be a potential measles case. So somebody comes in with a fever and a rash, what was their highest temperature? What was the fever onset date? If they have a rash, what was that onset date? Does the rash have any of the following characteristics? Was it preceded by one of these symptoms, the three C's? Basically, is asking if you had a prodromal phase. Did the fevers overlap the rash? Did it start on the head and move down? The measles rash tends to start on the head and kind of move down to the body. It's usually a maculopapular rash that can become confluent. It starts on the face, the hairline, and rapidly progresses downwards. It'll ask you about the immune status for the patients, the potential exposure to a known measles case. But given that we're in Westchester County and there's an outbreak, then that in and of itself is a high risk. And any specific high risk exposure in the last 21 days. That's really when we're talking about the incubation periods. So if you say yes to any of the B and C items plus a yes in D, E, or F, then really that's a concern. Having said that, the most infectious period is this period right here, and that's before the rash develops. So if you are concerned, if you had a high risk exposure and somebody comes in with the three C's, you may want to at that point say, listen, I'm concerned enough that I'm going to start pursuing this as a diagnosis or as a potential diagnosis. So we talked about concern. We said, all right, you're worried. So what should you do immediately? Mask, isolate the patient in the negative pressure room, assess that home situation for self-quarantine, contact the White Plains Hospital representative. To make it simple, all of these forms are on the internet. Any patient that had a potential exposure, fill out the exposure list template. That's on the internet. That'll be handed to the White Plains Hospital infection control liaison. Fill out the suspected measles information form. That'll also be on the internet. The infectious disease requisition. Now, these are for the laboratory testing. The communicable disease reporting form. Now, that will be sent to the New York State Department of Health, and information for that is also on the internet. The post-exposure prophylaxis. This is for those asymptomatic patients that are high-risk exposure. It'll help guide you in regards to the treatment. That'll be on the internet, and you could talk through that with the Department of Health and with the White Plains Hospital infection control liaison. This is the phone number for the Westchester County Department of Health. After hours, they told us just to stay on the line and just wait for all the prompts to end, and the emergency operator will pick up and help get you the right person. Should you have any questions or want any further information, the CDC has great resources in regards to this. Please contact Sangi Makala. She's our Director of Infection Control. You can reach her at 681-1148 or at the following email. Thank you so much for your participation and for your day-to-day care.